when I met with our hygienists, when I met with our clinical team, including myself, we had our own visions. We had our own ideas. We had our own thoughts. The one thing that I found that we all had in common was we had a common ground for purpose. We had a common ground for goals. Everyone wanted to be profitable. We wanted to grow. Everyone wanted to make more money. You wanted the patients talking about you. We want our patients talking about us, referring the patients to us. So we sat and we had a meeting and we decided that we together would always 100% of the time deliver excellent customer service skills. We wanted to like coming to the office. We wanted to feel safe where we work, and we wanted to grow individually and together as a team. So how did we do that? We sat and we decided 100% of the time we're going to be respecting each other. We are going to help each other grow. And we also are going to make sure that we stay on top of the latest technology and trends in other dental offices. We also wanted to deepen our relationships and our friendships with our new patients and our existing patients. So the way that we did that was together we created systems that remind patients that they are truly every day, 100% of the time, the focus of our practice. So some of the characteristics that you may consider for your office manager, and I just want to bring a point to show you. The slide before here has an S here where it says office managers. One of the most common questions that I get asked is, Gabriella, how do you do this all by yourself? So I just want to make it very clear that I do not do this all by myself. We at this New York Smile Institute, we do have a team of 3 office managers. And here the characteristics and traits that I've outlined are just some traits that each one of us brings to New York Smile Institute. It's not to say that every office manager needs to have this. If your office manager doesn't have any, these things can be learned through dialogue, through mentorship, through lecturing. Every single one of these things can be learned. So systems, I'm not talking about what scanner you use. I'm talking about a set of things that work together as part of a mechanism or an interconnecting network. So where do you have room to develop systems? In our office, we print day sheets, we print schedules. Before the start of the morning, we go through every single patient. I do it, the staff does it, Dr. Dean does it. We go through daily updates via email. Every day, Dr. Dean gets an email from our front office team with information, who we spoke to for the day, who canceled appointments, who left deposits, patients that we're trying to get back in touch with. We also print out unscheduled treatment plans, new patient lists, incomplete treatment plans. And then we also make an effort to make sure that we communicate and enter entries into the patient's journal. That way, everyone's always up to date on what's going on. Policies and procedures. So what policies and procedures do you have in place? So in our office for patients, we have policies and procedures that everyone follows. Consistency is the key when you're trying to implement new policies and changes. So we have policies for collecting deposits for treatment, for whitening, for surgical procedures. We have policies for broken appointments. We have policies for the prophy only patient and for the patient that insists on just having a prophy without x-rays. We also have a policy and procedure that we do follow when we're transitioning patients from practices that we've either acquired or merged. As a team, policies and procedures, employee contracts. A lot of times I find that employees are very confused. They're not sure what's in their job description. What are the expectations? So in every employee contract, we have a list, hours, descriptions, vacation requests, the protocol. We also discuss the importance of education. And we also discuss, of course, bonus incentives. So this is a little bit of a cheat sheet. There's a lot of information on here. Doctors and clinical team, administrative, and what we do together. So doctors, I meet with the doctors once a week. This is like utmost importance. We discuss patients. We discuss updates on labs in progress, cases that are on hold, anything, lunch and learns. One time we meet, once a month, we're meeting with our reps to discuss technology, training, treatment techniques. They teach the clinical team how to have these conversations with patients. This is so important. Administrative, I send Dr. Dean my emails 1 to 3 times a week. He's getting emails and text messages from me. Reports once a month, technology, community, cross-training, very important in the office. And together as a team, we have 1 time a month, 1 time quarterly, annually, social team building experiences. This is so important. Lectures 1 to 2 times a year with the team, not just the doctor, with the team. Invite your team to your lectures. Dialogue and coaching regularly. So important. First things first, entering treatment plans. So I have a little bit of a system here of how I enter treatment plans. Enter the treatment plan. It has to be done the day the patient has the appointment. No exceptions. Before the patient walks out the door, there should be a treatment plan entered. Phasing out the treatment, sequence of appointments, 2 to 3 ways to make it happen. Collect your deposit, get your financial agreement signed, copy, scanned. Patient has a copy, office has a copy. That financial agreement has to be updated every time the patient makes an appointment. Schedule the appointment. Scheduling reminders, follow-ups, patient journals, updating patients referred out. When you are referring a patient out to another doctor, it is so important that it's put into the record. You can print a report of the patients that you are referring out to track them. Make sure they're keeping their appointments. Call the other offices, ask them for your reports. It's another list that you can work out of. Tips. All of this will help you print your monthly reports, enter some events on the schedule, find a way for your digital software, for your software to work for you. Maintain communication with the front desk of referring doctors. Very important that when you call that referring doctor's office, you know who you're speaking to. The information is in the patient's ledger. Reports. Forensic life is what I call it.
Someone's asking if you can send a sample of your financial agreement sheet.
Yes.
Sure, absolutely.
Tell them to send me an email so I know who it is.
I hear you.
Okay, so this is a screenshot of the way that I print out my reports on a monthly basis. So if you look at all the categories here, there are 10 different reports that you can print monthly. You're printing your next month patients that are due for cleanings. You're printing out your statements. You're calling people who have balances. You're having conversations with your patients. Your unscheduled treatment, the treatment plans that you proposed where patients didn't schedule the appointment. You have your cancellation list. The people that did make the effort to schedule their appointment, but they canceled, they fell off the track, they need a phone call, find out what's going on, talk. Your recare, your hygiene, your past due list. The current year that you're working on, while you're printing out the next month, print out the same exact month from the year before. It'll give you an entire different list of different patients. And then here are just like the second, third, and second attempts on each one of the lists above. So if anyone would like a copy of this as well, I can send this. This is key, so much key here, so much information. Patients, new and existing. So new patients, every new patient has an interview with me over the phone. And this Dr. Dean and I have spent many years mastering this conversation. So a lot of people will ask us about the consultations. What's your fee? How much do you charge? Are the fees different for different types of consultations? The answer is 100% of the time. So cosmetic consultations, one fee, and surgical consultations, another fee. The interview sheet will give you a list of questions to talk to this new patient about. Hopefully you're in an undisturbed area, quiet. These patients that are calling the office, they want someone to speak to. So if you ask me what's the average time I'm on the phone with a new patient, I will tell you it's anywhere from 25 minutes. The longest time I've been on a phone with a patient was 1 hour and 40 minutes, okay? That consultation was $750 and it was prepaid. So I think that says a lot. Imagine paying that amount of money to someone over the phone that you've never met before. So important. It's true to my nature. I love what we do here. We love what we do. You love what you do. So just have the right person speaking to your new patients, a person that's a reflection, a true reflection of what your office stands for. Insurance breakdowns, greeting new patients, showing the office around, updating the doctor and team. If anyone would like a copy of our new patient interview sheet, just send us an email, send Dr. Dean a message, and I'm happy to email it over to you. Existing patients. So relating to your existing patients, right? You want to have, again, the importance is having conversations with patients. Get on the phone, send a text message, send an email. You think of a random patient, say hello, why not? Integrity, respect, clarity. Make sure that you have clear conversations with patients. And technology with your existing patients. Talk about what's new. What new scanner you have in the office, what new lecture you just attended,
COVID
having
test.
these COVID, exactly, what's coming out with COVID, the protocols, Have these conversations with your patients. Consistency is key here. Insurance practice in-network providers. So this is also a screenshot of just my breakdown that I receive when we are working with a patient where we're accepting the dental insurance. I can send this to you as well. This has a lot of information, just details. I guarantee you, if you have this filled out for every new patient before they come in, at the time that they schedule their appointment, when they make that phone call, if you have this filled out, you will be on the same page with that new patient, and that patient will trust you. As an in-network provider, patients are choosing you, and we sometimes assume that patients know what their insurance plan covers. And in every patient's mind, they think, oh, my plan covers everything at 100%. Not true. It's your job as an in-network provider to make sure that you educate these people on their insurance plans. Trust me, they won't forget it. Thank you. I hope you enjoyed all the information that I was able to provide. And if you have any questions, you can reach myself at that email or Dr. Dean.
Thank you, thank you, thank you, thank you. Gabriella has, as you can see, a knack for bringing people together. The two things that I do definitely want to touch upon on her presentation is when a new patient comes in and you present a treatment plan to her, and the patient says, okay, thank you, here's the consultation, and then I'm going to go back and think about it, talk it over with my husband, whatever the conversation is. Number one, most importantly, there needs to be a follow-up within a week. There needs to be a follow-up within a month. We have a stack of treatment plans that have not come to fruition, have not said yes. There's a stack of them. That stack is a very important thing for a young dentist, because if you present that 20 different patients and maybe one says yes, the other 19, doesn't mean they're saying no. They just need something else, whether it's financial, their timing, they're leaving, somebody's sick in the hospital. You don't know what their life is about. So the constant follow-up on those treatment plan patients, I can't tell you how valuable that is. And we're really on top of it, right? So we're calling a month, 2 months, 3 months. There's even a situation where it's 6 months out and I'll make the phone call. Hey, John, we talked to you 6 months ago. What's happened? Oh, I went to another dentist. Fine. Thank you very much. It's okay. Or, oh, so glad you called me. I was thinking about calling you. It's in their head. I just don't have $30,000. Okay, do you want to do the case for 15? We'll do the start at the top of 15. You can do that? I didn't know you can do that. So all of a sudden it's a yes, because they didn't know the parameter. They thought they had to come up with the $30,000. So the conversations are so important on those follow-up patients over the course of time. They've proven to be another source of income to the practice when they just a time has passed and they're just not ready to do it. So always follow up. Thank you so much. By the way, this was the first time presenting, so she did it today. Awesome. Okay, our next speaker is Dr. Nico Mavrostomos. He's a D4 dental student. This kid is me 30 years ago. I love Nico because he really works hard. He really cares about dentistry. He started the DMLC mentorship with me about 3 years ago when he was a sophomore and got all these dental students on board. So thank you, Nico, for being on board. Please make him the co-host.
Hello, everybody. Thank you for having me, Dr. Dean. So Dr. Dean asked me to speak today about my experience, and I'm happy to do it. This is also my first time presenting, so bear with me here. So what has mentorship meant to me? So honestly, Dr. Dean is taking me under his wing from an early stage of dental school, and I really didn't even realize how much I was learning from him and the FMR team until now, 4 years later. Taking on my own cases in the honors aesthetics program, and all my experiences that I've had so far through all my time at his office, all my time with FMR has really come full circle. And it's been a pretty cool journey, and I'm just going to share it very briefly with you guys here. So really my journey started in 2012, 2013 with my dad. He is a dentist in Bedminster, New Jersey. And that's kind of when I started getting my feet wet in dentistry, and I was just trying to figure out what I wanted to really do. And I wasn't really sure yet. And it was actually not until my senior year in college, my dad was in Boston at Tufts. I was a senior at BU at the time. And he texted me one morning, it was a Saturday, and he said, hey, I'm going to be at Tufts. There's this guy, Dr. Dean, speaking. I think it'd be cool if you came. And I had no idea who Dean was at the time. And I just said, why not? I'll go. And here's a picture of Dr. Appa speaking. Dr. Dean isn't in this photo, but he was speaking as well. And that's me sitting in the back of the room with my dad. And this was honestly a day that truly changed my life. And I'll never forget the day. I don't think I blinked once during the 2 hours that Dr. Dean and Dr. Appa spoke. I was blown away by their passion, by their knowledge. And it really showed me that there was really no limit to what dentistry could provide. And I was, from that day, my vision was extremely clear, and I knew that what I wanted to do. And 5 years later, I mean, I'm still here and I still have that same passion that started from that day. And that is something that I'm forever thankful for. And I don't even know if Dr. Dean remembers this day or not, but I remember him talking about occlusion and chomping his teeth like, yeah, it was that. So that was a pretty cool day that I'll really never forget. And fast forward again, 2018, this picture of me and Dr. Dean at Lavo eating giant meatballs, and Dr. Claudio here, Dr. Armin, Gabriella. This picture on the bottom actually is Aesthetic Advantage with Dr. Larry. I actually snuck in that morning. I was not supposed to be there. As a matter of fact, I said that I was an assistant for one of the docs, which I was not. I just wanted to get my hands dirty, and I really wanted to just see as much as I possibly could. And I've really done that as much as I possibly can throughout dental school. And, you know, I've always looked at dental school as just the bare minimum of what there is to learn in dentistry. And I've really strived to surround myself with as many people and as many opportunities as I possibly can to learn, because I know that there is so much to learn. And I really love dentistry. And it really started that day at Tufts with Dr. Dean. And throughout, I mean, FMR, all these events just continue to push me and continue to inspire me. And now that I'm a fourth year student in the honors aesthetics program, I'm finally realizing how much I really did learn, and how I really approach dentistry now has been shaped in ways that I didn't even realize were being shaped in the days I was just shadowing and just watching, and things were way over my head at the time, but all these little things started clicking together. And now, fast forward to 2021, we started DMLC, and mentorship has meant everything to me, because this is something that I'm extremely passionate about. And I'm extremely thankful that there are mentors out there in dentistry who really want to teach and really want to show you the way. And that's something that I learned that I didn't really know. I remember wanting to learn and wanting to have these mentors early on, and thinking that, you know, why would Dr. Dean take his time to let me come shadow? Or why would, you know, this person really care to teach a first year dental student? And it's so far from the truth, because I've learned that people in dentistry really want to help. And if you put yourself out there to accept it and put yourself in a position to learn and to be available for learning, the sky's really the limit, and people want to help. So that's something that's had a lasting impression on me. And FMR, you know, that's not just the technical parts of dentistry, that's just the big picture. But even in terms of the technicalities, I didn't even realize how much I was learning. And fast forward now, this is a case that I'm starting in the honors aesthetic program with Dr. Calamia. And, you know, looking at the case, there was a lot going on. And at first it seemed a bit overwhelming, and I had to kind of take a step back and really systematically go through it in the ways that FMR has taught me and taught everybody. Just starting with the simplest things and working from there, and not getting too bogged down on, you know, one tooth this tooth needs a root canal. Just looking at the big picture and understanding what the overall goal is, and kind of starting from there. So I'm just going to do a quick little run through of this case, just to kind of illustrate all the things that FMR has taught me and all the things that I've accumulated throughout the years, just watching. And so we always start with a midline relationship, and then we go into radiographs. Obviously here there's a lot going on, but I didn't allow it to get bogged down. I really kept my cool, and I've kept my confidence just through everything that I've learned. Dr. Dean always talks about incisal edge position at rest. This was kind of my starting point for building this case and designing what I wanted to do here. Dentofacial analysis. She has a gummy smile from 7 to 10. She's got old bondings, multiple crowns, old root canals that need to be redone. So there was a lot going on here, but I really just broke it down into simple terms. And I used everything that I didn't even know that I had learned to put this case together. And with the height ratios, these are all things that Dr. Dean and the FMR team has taught me to evaluate protrusive occlusion. Dr. Dean's always talking about occlusion, and the importance of it. And it's something that I've never really overlooked here. Balance side occlusion, left working side, right working side, microaesthetic elements. And this is something that Dr. Dean had talked about a lot, even through the COVID time. On his Zoom sessions, he always talks about drawing a 2D picture and really visualizing the direction that you want to head in. And that's something that's really stuck with me and something that I've started incorporating in my own cases. And this is really the first big case that I've ever really worked on. But I've used every single thing that he's taught me and that I've heard to give, and it gives me a lot of confidence. I mean, this is really my first big case that I'm ever doing. And there's going to be complications. There's going to be things that I run into, but I'm not really worried about it because I have confidence in what I've learned and in what I can pivot and make adjustments from because of all the experiences that I've had so far and just listening and just watching. And this is the wax up that I did for this case. Not to get into technicalities, but we're basically doing a full mouth case here, starting with the top 10 teeth and the lower 8, and then we're going to do the posterior teeth at the end to stabilize the occlusion while we do the anterior aesthetics. And then we're going to circle back at the end to do the posterior crowns as well, and just a few other shots. And actually, I remember looking at this case in the beginning and seeing the crowding on the lower anteriors and thinking there's no way we could do this restoratively. This has to be ortho. And I sat there looking at it, and I remember seeing Dean actually do a case just like this. And he spoke about a case just like this on his FMR series about how to treat the lower crowded anterior. And I just approached it just the way he had taught me. I used the stone model. I cut through the interproximals. I prepped through the arch form and just started waxing from there and to see what we could do. And we came to the conclusion that we could actually do it restoratively. So I just didn't allow the complications and the lack of experience and to hold me back from trying to do something bigger than what most can really do in dental school. So I thank Dr. Dean for that, and this is a case that I'm going to start prepping next week. So I'm looking forward to that, and I'm sure that I'll share my journey moving forwards. But my real message today was just to talk about how much I've really learned in dental school through doing things outside of dental school. And it's really not just going to class and passing exams. It's really about getting out there and making yourself available to learn as much as possible, because, the time to learn is never tomorrow or never when you're ready to do something. It's before. So, all my experiences, and I thank Dr. Dean and FMR and for taking me under their wings, because now I'm handling these cases and, I haven't started, and I'm sure I'll have complications, like I said, but I'm confident that I'll be able to handle it. And again, thank you, Dr. Dean. And I'm excited for the future and what it holds.
Nico is one of those students, as you heard him say, he kind of went into situations that he didn't belong. And I said, "What are you doing here?" He's like, "I want to learn." I said, "Okay, just keep quiet, go to the side, don't say anything to anybody." But that determination really shows you the kind of person that he is. And actually FMR doctors really appreciated his work because he actually helped out a lot. He wasn't just sitting there taking, he was giving a lot as he was learning. So thank you for doing all that. Dr. Alfred Hollis took our course. He graduated in '99. He took our course in 2016. Alfred is one of those doctors, when he came to us, he was like out for 15 years, and he said, "I want to learn everything. Just teach me everything." He just opened up his brain. He had no preconceived notions. He had no attitude. He had no 15 years of experience. I can do it. He just said, "I don't know anything. Teach me everything." And that to me is the best dentist, because he really turned out to be a good dentist who started out and now is really just a phenomenal dentist and a dental provider and has such a great practice right now. I'm so proud of what he's done with all the techniques that we've showed him. We still share great photos and great little FaceTimes together, and it's just one of those people that I look at him. It's like your own kid. You're just so proud of him because he's done so well for himself and his family. So I want to bring him on board. Go ahead, Alfred, take it away. I'll stop share. You there, Alfred?
Can you hear me?
Let's get you on. What do I do here? Stop recording. Hold on.
Yes, you're good, Al.
Okay.
Okay, it's playing over there.
Thanks, Dr. Allen. How are you?
Yeah, hit the recording.
Doing good.
Go ahead. You're on. Go ahead.
Hi, everybody. Hey, Dr. Dean, you know, on that page you showed, I show some of the things that I've gone through the programs I've been involved with. I'd love for you to be able to develop some sort of a symbol of FMR that I could put up.
You can take our logo. You can take our logo. It's fine. You can take it.
I think that'd be awesome.
Yep, 100%.
Anyway, my name's Al Hollis, and yeah, I did the program through NYU FMR between 2015 and 2016. I graduated in 1999, and I was 13 years an associate, which seems like a real long time. And it is, but why? Well, I was in a practice, a bigger practice, and every time I tried to leave, I was kind of given more percentage points for amount of production. So, you know, it was an interesting situation where by the time I left, I was getting paid 40% of production, believe it or not, as an associate. So everyone would look at me and say, why would you ever want to start your practice? Well, it turned out that my practice was going to be bought out, the one that I was in, by a big group, and I didn't want to be a part of that any further. So I decided it was time for me to do my own thing. I wanted to mention also that for some of the people in group 1 or group 2 that Dr. Dean was talking about earlier, I worked out a pretty neat deal with my owner of my practice where when I was doing my education and beginning my education through some of the various restorative academies you saw earlier, they're very expensive. And at the time, even in 2009, 2010, they're about $5,500 for each program for a weekend. And I knew I wanted to finish the 5 modules, and it's very expensive as an associate putting it on my own credit card. So I worked out a deal with my boss to make it a laboratory fee. So I produce a lot for the office, I always have. But what I did differently though is instead of getting the bonus that I normally would get, I actually parlayed that money into the actual education that I was desiring to take. And that way it wasn't such a burden on my personal finances and my personal credit card. And that really worked out really well. So I wanted to tell you guys that. So if that's a possibility, you can give that to your current situation and give that an idea, or give it a thought. I also want to tell you that, I begin with the 3 things that I really had to foster through FMR, and what it gave to me was continuing the passion and the perseverance and gaining the trust of my patients, my beloved patients. I'm in a small practice, 1,500 patients was what I was supposedly buying, and I bought it for a very nominal fee. I bought from someone who was on his way out and didn't really cultivate the practice per se, and continued to keep it evaluated. So by the time he was ready to leave, his numbers in production had gone down, and that really reflected the value of his practice. So with that being said, I bought it for a very cheap price. And I came in and said, I want to do this kind of dentistry. I want to do complete dentistry. I want to do aesthetic dentistry. And he said, Al, it's not the kind of practice. I can tell you the room that I'm in right now, the library that you see that we renovated, it didn't look like this a couple of years ago. I made this look the way it does because of FMR. Dr. Dean taught me to have a nice looking bathroom so people can look at themselves. Dr. Dean taught me to have a nice reception area. And basically the type of dentistry I was doing, the walls and the environs of this practice need to reflect the same type of dentistry that we're doing in the practice. So I really thought that was really important. I also wanted to share with you that before FMR, I was, I had a pretty good situation here. But we were able to go from this practice of having 1 doctor operatory, 1.5 hygiene, to 2 full-time hygiene, 2 doctor operatories, and really take the production into the stratosphere. We handle this by simply always being available to our patients. I had a concierge type practice mentality before I knew there was a word or a term called a concierge practice. So my patients have my cell phone number. We never say no. And the mantra in the office is service, service, service with a capital S. So with that being said, in 2012, we took this practice from, 850 to just shy of 2 million. And I'm not afraid to share that with you. and also tell you that we work 4 days a week. The 5th day is for FMR. I don't want to have the phone ringing. I don't want to take phone calls. I don't want any distractions. I don't want any emergencies taken away from me. The 5th day on Fridays is my FMR day, and that's the way it's always been. So, you know, I'm also an adult-only restorative and prevention practice. I heard Dr. Dean talk about earlier, deciding what you like to do. I loved surgery when I was a young dentist. I really did. I don't own a blade unless I'm going to, you know, do some composite, like a 12 blade to help finish a composite on some sort of anterior tooth that has a little ledge. I used to joke around saying to my surgeons, hey, I'd call them up because I'd have to take, a tooth out. I'd say, we have an emergency, half the root. And I would talk to my surgeon and say, hey, I took the top out for you. All you have to do is take the bottom half out. So that didn't work out too much. After a while, you start to say, what am I really good at? What do I want to do? And what's my passion? My passion is restorative dentistry. I love children. I love my own 3 children, but I don't want to work on children in the practice. I do enjoy some endo. I don't do any surgery. I don't do ortho, et cetera, et cetera. So that is part of the working smarter type of a mantra that I have been able to fulfill as part of what Dr. Dean has always taught me. I think the other thing is, do the right thing and the money will come. I really believe that your patient always knows what the right thing is. They may not use the term occlusal or buccal or lingual or anything like that, or know the numbers of the teeth. Some of them do. But the reality is that everyone kind of knows what the right thing is and how they're being treated. And I really do believe that if you take the approach of knowing that you want to do the right thing for your patient, they feel it and everyone on the team feels it. And that's just the right thing to do.
Dr. Gwen. Dr. Gwen graduated from dental school at New York City, NYU. She did her GPR residency. She came on board. She actually took one of my courses early on, 98, 95. And then she took our course in 2011. Not only is Gwen a team player, but she's one of the people that never complains, is always getting her hands wet. She could be assisting. She could be delivering laboratory cases. She's just a workaholic. I can't thank her enough for being part of the faculty now. She's part of the faculty. She was junior faculty. Now she's full faculty. Constantly there for the team. Never about I, always about the team. And again, those kind of people are the people that I just love because they really take care of the residents. They take care of the participants. They take care of the faculty. They take care of me. She's just an awesome human being. And she's a great dentist. And she's the one I was telling you who had an 80-20 insurance practice. And now it's at about 50-50, but I'll let her tell her all the details. Thank you, Gwen, for coming on board. Thank you for spending the morning with us.
Hi, everybody. Can everybody hear me? Hi, Al. Actually, Al and I took the FMR course together. So your dates are a little bit off, Dr. Dean, but I'll correct everything.
Okay, thanks.
Thank you for having me. So I started dentistry as a kid, actually. I was 15 years old. My dad was a dentist, and I started being a dental assistant. And I just fell in love with the office. I fell in love with teeth. There was just nothing else I ever wanted to do. So I dental assisted. I went to college. I actually became a dental hygienist. And then I took my path to dentistry and I graduated in 1998. I was not able to do a GPR. My dad said, I'm selling the practice or come work with me and I will teach you for a couple of years, and then I'm going to retire. So I went straight into private practice. I kind of wish I did a GPR, so I definitely recommend that to others, but it just wasn't the path that was right for me. I wanted the practice. My father had a very successful practice in a small town where I grew up in Bayonne, New Jersey, and I wanted the practice. So I worked there for a couple of years, and then my father retired. He also had an associate who moved to Florida the year after that. So 2003 now, I'm there alone. And I started taking Dawson courses during this period of time. I took a whole bunch of other courses. There's a Jersey Shore course that's like once a month, every year. It's a nonprofit. He has great people come in. Buchanan's teaching right now, doing endo, but all great speakers. Dawson has been there, Coyce, a million high-end speakers. So I started taking those courses, but then I started getting implant restorations in my office. So back in 98, when I graduated, we didn't learn implants. We didn't learn FMR. We didn't really learn a lot of anything. I get into private practice and I start seeing implant restorations now, and I break a screw. And I start realizing that I don't know as much as I thought I did from taking Dawson courses. I'm afraid to use the face bow. I don't feel comfortable shoving people into CR. And I start realizing that I'm floundering and I'm alone. There was no Facebook groups that were easy to talk to and people to communicate with and have this group of friends that you really could get answers from. I was embarrassed to ask my periodontist or anybody I referred to, like, I don't know how to do this case, because I didn't want them to not refer to me. I didn't want to lose patients. So, I started really struggling. And then I saw Dr. Dean was offering this course in Woodbridge, 2005, an implant restorative course. And I said, you know what? I have to take it. It was the best thing I ever did in life. I met Dr. Dean. I take this implant course. Now I can restore implants. So I start restoring implants in my practice. I start seeing more of those. I feel like everything I started learning started following me. Then Dr. Dean, at the end of this course, offers us to take Aesthetic Advantage. He was teaching there at the time. So of course I jumped at the chance. It's an expensive course, $15,000. I didn't have this kind of money. He goes, wait, you have the patient pay for part of it. I'll get you a discount. I'm teaching. I'll help you find a patient even. So I take the course. I end up treating Dr. Dean's cousin. He's my mentor faculty, and I learn how to do veneers. Guess what? Veneers start following me in my practice. The next year I do level 2 Aesthetic Advantage, another great course. My patient from my office was approved. I had him pay for half the course. He paid for the lab fill. He paid for half of it. I paid for part of it. Total win. Totally making money doing veneers now in my practice. I sign up for this patient. I get him approved. I go there the day we're supposed to prep. The mentor faculty who was supposed to help me backs out and says, you can't do that case. I was jumping a crossbite on number 6 and 27. He said, this case isn't going to work. So what does Dr. Dean do? He says, I'll do the case with her. So he does that case with me. And that case is still in that patient's mouth. 15 years later, I still treat that patient. So it was a successful case. That faculty was wrong, and he's still teaching Aesthetic Advantage, but it's still a great course. It's an amazing course, and I would highly recommend that as well. So at this point, I buy my building and my practice, where my practice is. I buy the building, $500,000. So I've been paying that off, and actually this month I made the final payment on that building. So this is how life goes, because if you really work hard, you can achieve what you want to achieve. So now I really can pay zero rent on my building because I have 2 renters upstairs. So during COVID, I was really in great shape. It really helped me a lot. So those are things to think about depending on where you're practicing. If you can buy the property, it's going to be an asset down the road also. So after all that, the economy tanks, right? 2008. So what do I decide to do? I've been speaking to Dr. Dean periodically. He bought a CEREC machine. So I said, you know what? I'm going to invest. So I had more time on my hands. My practice wasn't quite as busy. So I bought a CEREC machine, and I spent that year doing training and learning how to make onlays myself and crowns myself. Now, fast forward 15 years, I use the Medit scanner now. I don't use CEREC anymore. But at the time, even making onlays was just an amazing, productive thing to do. And I found that, like I said, every time I did something, I found those cases followed me more. So then I took a CE break. I had my son, I had gotten married. 2013 rolls around, and my local periodontist calls me and says that he became on the advisory board for New Jersey Dentist Magazine, and he recommended me. So they only pick 5% of dentists in the state, and I ended up getting selected that year. Changed my practice again. I started seeing more patients come in because they had seen me in New Jersey Magazine. Besides that, all my patients who had confidence in me before, I can't tell you how many of them sent me notes saying, I knew you were a great dentist, but now this just, sort of gives me more confidence in you. They just congratulated me. It was such a nice experience. Now this periodontist then starts referring me patients. And I started thinking, well, why is he referring me patients? Am I really deserving of this New Jersey Magazine? And I didn't feel like I was. So I had seen Dr. Dean, and I got on the waiting list, and I started taking the FMR course 2015. So again, amazing experience. My periodontist now starts referring me patients like crazy. And I'm not saying little cases. big, full arch restorative cases with implants, natural teeth, combinations, complicated cases. He starts referring more and more and more and more. I finish FMR and I say to Dr. Dean, can you please let me stay? I really want to see what other students are doing. I really would like to audit, as opposed to just seeing patients, being in my own operatory, working on those cases, which were amazing and valuable. I learned even just how to trim a provisional better. 15 years into practice, and I didn't see the value of opening up the embrasures the way I do now. And like just such the smallest things that you just don't realize you're missing when you're alone on your island, not interacting with other dentists and not learning from them. So I begged Dr. Dean to let me stay. He did. So I stayed for 2 more years auditing. And sometimes I would be a gopher. Sometimes I would be an assistant. Sometimes I would help a student. Sometimes I just treated emergencies. I just was there all the time. I asked him if I could stay. And he did. What I've noticed in FMR is that if you want to learn, you will. Any of these courses you want to learn, you have to pay attention though. I've seen students, as soon as the faculty doctor walks into the operatory, they walk out, they whip out their phone, and they're looking at Facebook. They're looking at their messages. My phone is in my purse, in whatever the main area. I don't even look at it for 3-4 hours. I could miss something. I could miss an emergency call, but my focus is there. That's when you want to pay attention. When those faculty go sit down and look at your patient, that's an amazing moment. That's when you're going to learn everything. Don't walk away at that moment. That's the time when you really want to pay more attention. So anyway, I find that all those things are so valuable. So my periodontist, I never expected he would refer me patients. My expectation was never that a specialist was going to refer me patients. Keep in mind, they do. And now I see that. I see more referrals from my orthodontist than I used to. I see more referrals from sort of everyone, because I think they see now that the quality of my work has gone up. That doesn't mean I think I'm wonderful. I have a lot to learn, and I'm trying to learn all the time. But I've gotten into New Jersey Magazine probably about 6 times now. 1 year I didn't. The following year I did again, every year since. I've gotten in America's Best Dentists, Who's Who has contacted me. I'm on some other top doc site where they send me questions and I answer questions for patients. Just all these amazing things. Now, it doesn't make me great. It just means that people see my name more. Patients see it more. They're more impressed by that, and they have more confidence in you when you do those things. And I have found that every time I did a class, those things followed me. Did I see them more? Maybe. After I took aesthetic advantage, did I see the opportunities for veneers? Maybe. Was I just more confident that I could do it? Maybe. I don't really know, but I do know that when I took implant courses, those implants followed me. When I took aesthetic advantage, veneers followed me. When I took FMR, I'm doing a lot more FMR cases. So the money has followed every time I took a course. It was worth the investment every single time, by far, like 10 times. The other thing I want to share with you is that my production is up. So even though I still take a lot of PPOs, I'm in a city in Bayonne, very middle class, I'm more productive because I can do it faster. I've gotten the recipe for success from Dr. Dean, which is those SOTs, the sequence of treatment. It's a cookie cutter sort of recipe. Do the wax up, every step along the way has been made easier. So I'm quicker, I'm more efficient, I'm more confident. There's less adjustments. I have better labs. All of those things has made my life easier, less stressful. And my staff sees it. They say, I ask them, how does this look? How does that? Oh, it looks great. They can tell me, oh, this edge is too long, or what, I'm open with them. I always say it's an honest policy. And I think patients see when you have integrity and when you're trying hard, because I've been successful all these years, even when the economy was down, even after COVID. The second I got back into my practice, May 26th, I don't have an opening ever in my schedule. If somebody cancels because of COVID, I fill it 2 minutes later. I've been and I don't make a fortune, but I love dentistry. I work 4 days a week, and I really enjoy it now more than ever because I'm not on my island anymore. I have a purpose. I have all these friends that I can talk to. I'm on a group on Facebook of women dentists, and every so often they'll talk about veneers and how they all hate doing veneers. And I'm like, are you crazy? They're amazing to do, and they're not difficult. You just have to take the right courses and learn how to do it properly, and then you'll be successful. And I think that's what's missing. People don't see that value in education. I really applaud you, Nico, because you are so far further than I was probably even 5 years ago, that I can't imagine where you're going to be in 10 years. So impressive. And everybody should really follow your lead. And I just want to thank Dr. Dean for all the years and all the mentorship, because without it, I can tell you, I would probably be very unhappy today. But as a result, I love dentistry and I love my life because he really made all the difference in my life. So thank you, Dr. Dean. And I'm glad I have a purpose now.
Thank you, Gwen. That was amazing. I didn't even know all that stuff. I forgot about that you did Charlie's teeth. I totally forgot about that.
Yeah.
My cousin's teeth. They're still there. It's 15 years later. They're still there. Great testimonial. If you really listen to what Gwen was saying, she talked about how that it's like a step by step. Like she took one, then she took another, and she grew. And that's what it is. It's really like a growth process of growing in dentistry. It's never about I know it now and now I'm good to go. Yeah, I'm constantly learning. I'm constantly listening to people talk, and I see another case, and it's another case. So it's a constant learning. And I think once you put yourself in that mind frame, I mean, the sky's the limit. I mean, it just never ends. And that positivity always keeps going. Another great human being who I've met, Dr. Margolin practice is literally a half a block away from my house. And I used to always pass by and say, who are these Margolin Associates guys? I want to come one day and meet these people. Because I moved there about 20 years ago and I didn't know who these dentists were, but I never went in. Sure enough, 20 years later, Dr. Margolin walks into FMR and he says, I'm Michael Margolin. I go, are you Margolin Associates? He goes, yeah, I've been dying to meet you. I go, what are you doing here? He goes, it's 20 years I've been out. I goes, I can't take it anymore. I need to learn something. So Dr. Margolin, please tell him your story.
Okay, so today I'm going to talk about FMR and how it changed my life. And let's get the show on the road here. So I'm going to introduce myself. My name is Mike Margolin. I am a general dentist now for over 30 years. I graduated from Fairleigh Dickinson in 1990. I joined my father's practice immediately out of dental school, so I did not do any sort of residency program. Our practice is primarily insurance-based. This has gradually begun to change as of 2016. We also have a reputation as being an affordable practice, and I've had people that come and sit in my chair and say to me that, I heard you guys are really cheap, so that's why I'm here. And I can't tell you how frustrating that has gotten. I remember Dr. Dean's, one of his early lectures, he talked about how his office is set up like the Ritz-Carlton. And I thought to myself, well, my office is set up like the Holiday Inn. So, as a younger dentist, you might want to consider trying to gear your practice towards what you want, because it's hard to shift gears after 25 years of practice. So it's definitely worthwhile to think about, what kind of dentist you'd like to be. If you're here today, the chances are you don't want to be a Holiday Inn type of dentist. You want to be a Ritz-Carlton type of dentist. Anyway, I've made that shift since 2016. That has pretty much begun to change quite dramatically. Okay, so I'm primarily focused on single tooth dentistry, and this has also begun to change since 2016. And I could actually say that I hated dentistry, and this has completely changed since 2016. I started the FMR program at NYU, and for me, pretty immediately, a light bulb started to go off. So let me talk about how FMR affected me, and I would use some key words to describe that. The first would be passion. I think as soon as I started to see that I could actually do life-changing dentistry and have an impact on people's lives, it got me excited about this type of dentistry. The second would be vision. One thing we start to learn in FMR is that we start to look at the entire mouth rather than looking at each tooth individually. And all of a sudden, your vision completely changes and you can see everything going on in someone's mouth. And it really just makes you much more, you're able to see everything that's going on, and you're a much better dentist as a result. The third thing would be knowledge. We learned a lot about smile design, aesthetics, occlusion, implants, implant abutment design. We even talk about how to sell dentistry and the business of dentistry. So there's just so much practical information that you learn being part of this program. Another thing would be organization. When you go from doing single tooth dentistry to full mouth cases, you have to become much more organized. And our program, we have something called the sequence of treatment, which is an SOT, which is a blueprint or a roadmap to kind of figuring out the entire case before you even start it. So it's like building a large building. You're an architect and you have to come up with all the designs and the blueprints and before you even touch the patient. So that's, I've been to many courses all over the country and they teach you plenty of things, but something basic like that, they don't even get into. And that's really one of the keys as to how to get these cases accomplished in your practice. And then once you put the passion, vision, knowledge, and the organization together, you start to develop confidence that you can actually do these type of cases. And that confidence helps you sell cases because that, when you sit down and talk to a patient, you feel very comfortable that you can explain the whole case and how you're going to be able to accomplish it and achieve great results. It also helps you when you speak to specialists. I think before I took this course, the specialists used to kind of guide the case and tell me what, they're going to put implants here or do this and that. And now that I tell them, this is what I want. And if they don't agree with me, or I just can look for another specialist that I want to work with. So that helps quite a bit. So let's look at a case, and this is actually a great illustration of where I was at as a dentist after 25 years before I took the FMR program. And this is one of my patients, and I've seen him for over 20 years. I didn't address any of his wear issues. I don't even know if it's possible I wasn't even aware of them. I restored several teeth, just keeping his same occlusion. You can see a crown on number 21, 28. I even did that. I remember doing that crown on number 7. And if you look at that crown, it's actually longer than 8 and 9. So my aesthetic eye must not have been too sharp at the time. But this is where I was at. And what happened is he came in maybe 4 months into me taking the program, and I looked at him and I'm like, wow, I got a great case here. So all of a sudden, my vision had completely changed, and I was looking at his entire mouth and I could see everything that needed to be done. So I followed the steps that we learned through the FMR program, and I was able to restore his upper arch. Maybe a year or two later, he came in and, he's talked to me maybe about doing something on the bottom, getting rid of that lower partial. So then we went and restored the lower arch, and now it's frozen again. Okay, there we go. Okay, and this is our final result. So we were able to do a beautiful case. We restored the top and the bottom. And let's take a look at the patient. There he is. He looks pretty happy. I'm pretty impressed, this is something that I was able to accomplish all from taking this course. So let's ask the next question is, how much money did I make on a case like this? And the answer would be very, 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 very little. And so I would say, why would I do a case like this if I was making so little? And the reason would be for experience. You know, it's one thing to take a course and do cases with faculty around keeping an eye on you, but then it's another thing to actually start doing these things in your office. And the only way to really become good at doing these type of things is just to jump in there and start doing them. So his insurance wasn't very good, but I really felt I just wanted to do the case, and you know, I could see exactly what needed to be done, and it was a great experience for me. Another thing, it's a good experience for your staff to see you do this, because all of a sudden they see, wow, you know, you're taking these courses. This is what you can do. This is a big change from what I've been doing all these years, which is just much smaller cases. So it's a great experience to do that. You also can see, you know, is your lab capable of handling cases like this? You might have to start looking for different labs. So there's a lot that you'll learn from doing cases like this. The other thing is confidence. When you start doing a case like this, then you can feel more comfortable doing more cases. So the more cases you do, the more confidence that you build. And the last thing would be developing a portfolio. When you start doing cases like this, you can take nice photographs, and if you have another patient that comes in, you can show them the photos and show them what can be done in their mouth, and that helps you get more cases. So just to finish up, FMR, it's life-changing for the patient, and it's life-changing for the participant as well. And thanks to being part of the program, I've been able to do many life-changing smiles for many patients. So I'd like to thank everybody for their attention and time today. I'd like to thank Dr. Dean for his leadership, enthusiasm, his generosity, and his hard work in putting all these programs together. And just wanted to wish everybody a Happy New Year. That's it. So that's the last slide.
Thank you.
There we go.
Thank you, Dr. Michael. Thank you so much. It's that kind of education that you see dentists who are starting out, dentists who are in the middle of their career, group 1, group 2, group 3. And when you get to group 3 doctors, they have the skills. They actually know the dentistry. They just don't understand how to put it in order and get it organized. And that's why Dr. Margolin probably exceeded in terms of the speed of how he got it implemented a lot faster than most, because he already had the practice ready. And he just needed to implement it into the thought process, into the speaking of it, into the photographs of it. And then that became part of his world really, really fast. Which takes us to the next part of our finale here. External marketing in these times. So I always say, and Dr. Margolin, without me knowing it, I said, wow, that's a really great case. How much did you get paid? He said, no, I didn't get paid hardly anything. So it was exactly that kind of concept, taking these 1 or 2 or 3 pro bono cases and really making them work for yourself, for your documentation, for your expertise. You close the office on a Friday, you just work on that patient with your assistant, and you create these 2 or 3 great befores and afters. And then your external marketing can start. I see people doing external marketing and they're not really showing testimonials. So for me, it's having the cases, number one, having the testimonials of the patients, the videos of the patients, how their experience changed before and after, very powerful thing. And then you actually going to figure out, well, what do I want? Who am I marketing to? What's my age group that I'm really going forward to? And am I looking to the right people to refer back to me? You heard Dr. Gwen say, as she got better, the periodontist started referring back to her. In your early years, you want to connect with the doctors around the area, gynecologists, therapists, eye doctors, restaurant owners, staff, bartenders. I mean, these times are tough with restaurants, but I've always connected. My first 5-7 years, I connected with the community so that they knew I was the dentist. Here's my cases. This is what I do. It becomes about, you promoting yourself, not in terms of, look how great I am, but more like, this is the kind of dentistry that I can do. And again, having your business card always around with you, letting people know that you really care. Hey, whenever you're ready, I'm here for your family. And it's really you're selling yourself. You're selling your confidence, your personality to be the best dentist in your community. That's the whole thing, is being the best dentist in your area and really showing that. Now, what happens with that is you want to get better and you want to be more consistent. So these are just some 2 pro bono cases we did early on. Again, and then if you're going to do a pro bono case, go into it 100%. Don't go into it with the cheaper lab to save some money. Go into it as an investment. So instead of investing money in marketing outside, I'll invest $3,000 on a case and I'll do the case perfectly and document it and get photography to get it to look beautiful before and after. The same thing. So when you're doing pro bono, sometimes pro bono cases go bad. You got to do them over. Something goes wrong. You can't be like, well, this is a pro bono case, so I'm not going to give you my all. No, it's you go all in on those pro bono cases like it's your own family and make the case look spectacular. And if something's not right, take it off, do it over. You want the end result to be the best it could possibly be. And that really, again, makes you feel better, your confidence feel better. Now, you're going to have resistance. In daily life of dentistry, you're going to have resistance with the staff member, with the patient, with the laboratory, and with your family members too. I always talk about don't get in the ring. When something volatile happens and the patient's really, really upset and they start yelling and screaming and on the phone or whatever, I back off. I become a professional. I don't get into the battle. I don't get into the ring with them. I calm them down. I said, let's talk about it tomorrow. Let's calm everything down. And let's revisit it tomorrow. Let's make some decisions tomorrow when everybody's not volatile. There's situations where a patient gets very upset in the room and they literally start using vulgar language. I do not enter that room. I do not. And they say, Dr. Dean, they're waiting for you. I said, I'm not going in. When he comes down, I'll go into the area. I'm not going to go into a volatile situation where it doesn't matter. I'm going to probably lose no matter what. So I don't get in the ring unless everybody's calm and we're professionals, ladies and gentlemen, talking to ladies and gentlemen. And then we can have a conversation. So it's really important to understand your limitation. Always be respectful. Always be a professional. You are held at a higher level. It's not you're on the street with a couple of friends. You're the professional in that practice, even if it's 1 or 2 or 3 years out. And if you're not sure and you're uncomfortable with the conversation, say, I'm not comfortable with this conversation. Let's sit down and look at the facts. We'll talk about it tomorrow. Let's wait another day, 24 hours kind of clears your head. You can get some advice before you get in the ring. So I always say, don't get in the ring because you're probably going to lose if you're dealing with somebody who's very volatile. When people don't meet your expectations, this happens all the time. It could be a staff member, it could be a family member, it could be a patient. When they don't meet your expectations, you can get mad, you can dismiss them right away. I like to teach them once, teach them twice. And then after that, if they don't get it, then obviously they're not going to really perform at that level. But then also a big part of it is we're expecting people to be at this level. I'm expecting everybody in my office to be at my level in terms of perfection and accuracy and honesty. Sometimes people can't reach that. That's been my biggest, hardest thing for me to handle. Why can't everybody do the prep the way I do it? And I used to get frustrated. Why can't people be on the phone the way I would be on the phone? And I used to get frustrated. So I realized I've controlled myself and I said, listen, I can't expect everybody to be at my level, but I could expect these are things I expect you to talk thoroughly, get some more education on speaking, get some more education on dentistry, become a better dentist, become a better person. Obviously, if you can't and it's frustrating and they're not even listening to basic rules, then maybe you have to move on. But you have to kind of focus on yourself too, because if you're expecting this and they're not reaching it, it's hard to make people reach your expectations of a high level. Some people just don't work at the way our work level. I work 6 days a week on presentations and I never stop. That's my commitment to the dental profession. Some people don't do that. I can't judge them. That's their livelihood. So that's what happens when people just hit a wall. So this is a little slide that I always like to put in. They told me I couldn't. That's why I did it. I got kicked out of Columbia Dental School. Some of you know the story. I started Columbia Dental School. I didn't make it. I wasn't smart enough. I was failing. And they told me to repeat the year. I basically got kicked out of dental school. And I was in that turmoil for many months. I didn't know what I wanted to do. I knew I wanted to be a dentist, but I didn't know how to do it now because I just failed out. So I called up NYU and I started NYU. So I started my career again. I failed out in 85 and I started over. And in 91, 6 years later, I'm a prosthodontist in Manhattan, the youngest prosthodontist in Manhattan. So again, the perseverance of your goal, your perseverance of being your motivation and sticking to what you really believe in down in your heart, that's going to get you through the tough times. The funny thing happens in 95. I'm with a big group. I thought I was learning. I was producing a lot of money for them. I thought I was a good producer. I thought I was a hard worker for them. And then something happened. Some financial and family problems came into the situation, and they let me go. And I'm like, wait a minute. I've been working 5 years for you guys, making a lot of money. Well, I thought I was a good employee. They let me go. And again, you're confused. You're like, why would this happen? I worked so hard. It wasn't my ability. So what was it that they let me go? Again, there was personal things behind the scenes that I found out later. But that was the best thing. At that moment in time, it was the worst thing in my life. I got kicked out of a big prosthodontic group. But then I had to reassess. And that's been, I guess, my whole life is reassessing where I am and going to a different direction. I worked for 3 years. I bought my first practice in 1998. I was 7 years out of prosto. And I could never, ever have been where I am today without that cut. Same thing happened to Steve Jobs, right? They just kind of cut him and then he started a whole new company. These things are going to happen. The rejection of life is going to happen. How you handle it, having support system, having people to help you is what we're offering to you. Having somebody to lean on and say, hey, what do I do in this situation? I moved on, I bought my practice, and from that point forward, I was my own boss. If you want something you've never had before, you have to be willing to do something you've never done. Zoom classes, we never understood what this was about. I didn't know what Zoom was. And I had to, if I'm going to make a change, I had to make a change. We made the change. I spent hours and hours revamping my whole program to make it work for Zoom. We did this retreat. We couldn't have the retreat uptown. I had to change it on. I wasn't going to cancel it. I wanted it to go on in this format, as good as it could get. We were going to have 25 people up there. Now we have 100 people today. So everything changes for the better, I believe, but you have to be willing to change. An investment in knowledge pays the best interest. I find that to be very true. Staying comfortable in your own environment, staying comfortable is the enemy of progress. It's a very, very famous quote. If I can get the quote to stay on. Staying comfortable is the enemy of progress. You can't just stay in your zone forever. You're going to have to move out of your comfort zone. And we're going to help you do that. We're going to help you do your first case. We're going to walk you through a case. I was on a Zoom call last night at 6 o'clock with two great dentists up in Boston. And they're like, Doc, I don't know what to do with this case. We spent an hour and a half, not an hour and a half, about a half an hour talking about it. I wrote down some SOTs for them, and it got a little clearer for them. They said, okay, I kind of see it now. Okay, they've been practicing for 15 years. So again, it's having that kind of camaraderie to be able to send out an email and say, hey, let's talk about a case. You got to be able to stay out of your comfort zone. Dr. Kumar, thank you for this message. I'll never forget this. Someone once told me not to bite off more than I can chew. I said, I'd rather choke on greatness than to nibble on mediocrity. What a great quote. And that's what it is. Dr. Nico was not allowed to come into Aesthetic Advantage. He got himself in. He asked people. He got himself into positions that he didn't belong to get better because of the conviction of wanting to learn. Being great is possible. Being great in your community is 100% attainable. Remember, the competition you have is the other dentists around your neighborhood who don't know about FMR and don't really care to learn. The point is, you're going to use this for your advantage. Take advantage of that some people don't want to learn. Today, it's a dream. I had a dream 15 years ago that I can teach around the world. Boom. I dreamt it, I saw it, and then I have to act upon it. A dream without vision doesn't become real. It just disappears. So write down your dreams and your visions and then take the action. Being prepared for the opportunity. When this opportunity came up, I was prepared. I had everything ready. The opportunity came up and then I took the opportunity. It's not luck. Oh, you're so lucky to have FMR. No, it was hard work with a lot of hard faculty behind me. It's people that saw the vision of helping others that allows us to grow. It's the vision of actually giving back from the glories and the blessings that we've had to give back to the dental community, especially the dental students who really need it the most at this time. There are very few real good dentists in your area. They're not interested in becoming better. This is your advantage. Take advantage, be the best you can be in your area, and FMR is here for you. It's just about being the best you can be at any moment in time. What's next? We introduced the FMR sessions. A 4-day course is coming up in May and in June. And then again in October, it will be together. And for your out-of-state doctors who can't do the full-time Friday course, I ask you to get a case, and hopefully I can come there or you can come here and we can do cases together. Anything is possible at this point. So the new FMR sessions, you can go on to FMR-NYC.com to sign up. If you can make a donation to St. Basil Academy for Children, I would appreciate it, and they would too. Whatever it is, $10, $20 is fine. Go on to the website FMR-NYC.com and go ahead and sign up if you want to. If not, I'll see you hopefully in May for our sessions, for our live sessions. I want to thank the faculty. I want to thank Nick. Say hello.
Hello.
Hello. He did all the work here with our Zoom sessions. We had to have a limited amount of people. You can close that. Now you're bouncing off. And I want to, of course, thank the FMR family and participants this year who've been patient with us through this whole transition period of the COVID situation and the testing and all that. We limited our staff, we limited our patient treatment rooms, but I can't thank you enough for your patience. We're all going through this together. It's not the way we always envisioned it to be, but it's the best version of what we have today. So I hope this has been informative for you. The recording will be available if somebody missed part of it or one of your friends wants to have it. We're happy to share it with you. If you'd like to sign on for our February sessions, that'd be great. Love to have you. And that's it. I hope you got something out of it. I hope you got something to take home to your practices. For those of you in dental school, I feel bad for you. I'm sorry. We're here to help you. We'll do anything we can to get your education better. We can do prep designs with you. If you want to bring a model, try to talk through a case, or just have a conversation, all the faculty are open to helping you through this course. For those of you who are graduating and residents, I wish you the best for 2021. For the doctors out there going through tough times, again, stay the course. Reach out to us if you need it, and we're always here for you. The FMR family thanks you, and I thank you for being here with us today. Have a wonderful year. Have a wonderful weekend. Enjoy yourselves. And again, reach out whenever you need to. We're here for you. Thank you and goodbye.
Hello, my name is Dr. Dean Bafiotis, and I'm the director of the NYU FMR course. We believe we give a great educational experience to our doctors. There's a lot of different courses you can take, but our course fosters great education with practical knowledge that really helps our dentists become very successful in their own practice. We want to help you make the right decision for materials, the products, the laboratories that you use, to really get the confidence you need with the right materials to develop and directly make the beautiful restorations that we all love. We want to instruct you on how to make those decisions for every tooth and every patient. That's going to make you a successful practice. This is the practical dental knowledge that we want to teach you in a step-by-step process, more like a cookbook approach to doing full mouth rehabilitation. This is going to get you to be confident every time you see that patient, to classify them into different levels, and to put the knowledge that we give you to work every day. We have hundreds of graduates of FMR with hundreds of testimonials of patients and dentists that have changed their lives. The techniques and the processes that we use are real and are practical. We teach reality dentistry, digital dentistry, in an organized workflow that really makes sense for you, for your practice, for your team, to really get you motivated to deliver beautiful smiles. We are FMR-NYU. We want you to spend a day with us at the office to see how we actually do this on patients. Even at the FMR clinic at NYU, we invite you to come down. We want you to be part of our FMR family so that you can continue to learn and be successful and confident in your practice. In my 30 years of teaching, I found the best way to learn is by visual learning on a patient that's right there, a live educational experience. That's what we provide, and that is an invaluable type of education. And I'm speaking even to the younger dentists who really didn't get that experience in dental school. I know you have lots of debt and you have to pay your bills, but this is one way, the course of FMR, to get you to the level where you can be confident and do great dentistry. At FMR, we create confidence, security, techniques, and practical knowledge to get you to the next level. We want you to be successful, and that's why we do what we do. And we want you to be excited about your profession. We want you to go into that operatory, into your team, and really change people's lives from your attitude and from your confidence. So come visit us at FMR-NYC.com, or you can email me directly at drdean17@gmail.com. We want to change your lives, and we want to change your patients' lives as well.